So my name is Kirsten Walters, student ID, scan the room. Knock knock, hey Mr. Jones, I'm going to be your student nurse today here at South Alabama. So the first thing I want to do is I'm going to verify the order in the hospital policy. So I do want to make sure that you are my correct patient. So I'm going to be using your name and your date of birth, which is Jaguar Jones, and your date of birth is August 25th, 1963. That does match up on my patient care order form and on your hospital bracelet. And I do see that you have an allergy to penicillin. Are there any other allergies we need to be aware about? Good. So there's no other allergies that we need to be aware about. So what you're getting today, you're getting a IV insertion. It's going to be a small little prick about right here. Do you have any questions or concerns? Good, so there's no questions or concerns. I verified the order in the hospital policy. So now I'm going to set my hospital care order form over here, and I'm going to position my trash can, apply hand hygiene. I'm going to come over here and apply my goggles. I'm going to come back over here. And now that I have applied hand hygiene and my goggles, I'm going to raise the bed to a comfortable working height, about waist level. I'm going to lower the side rail, and I'm going to make sure that my patient is comfortable. I'm also going to be placing this in case there are any spills or messes. We want to, normally I could just get the patient to lift their arm, but do not today. Yeah, so now I'm going to come over here and I'm going to open all of my packages sterilely. So I've already gathered all my supplies. So I'm just opening them all away from me. And that was opened. Okay, so now that that has all been opened, I'm actually going to clean. So I'm going to clean this very good. Make sure I get the tip very good. And I'm going to connect it. I want to squirt a little bit. Connect it. And I'm going to flush it. Good. And now I'm going to loosen the cap. And I'm going to place it back in the bag. So now I want to talk about 3 principles for selecting a vein. So you want to do the most distant part. You want to make sure if you can do it in the non-dominant arm, you do that. And you want to find a large, soft, and bouncy vein. And then 3 principles for vein distension are you want to stroke the vein lightly when you're selecting the vein, or just stroke it lightly. And you want to do a warm compress for several minutes. And if they can make a fist like this, you would get them to do that. So now I'm going to apply his tourniquet. So, Mr. Jones, I'm going to get you to lift up your arm. Thank you. And now we're just going to... So, his tourniquet's good to go. So now I'm going to go and apply my gloves. Being careful not to turn my back to my patient because his side rail is lowered. So I'm going to come back over here. I'm going to move this closer to my patient. Again, it's all in the bag, so nothing is breaking sterility. So I'm going to come right here. I'm going to use my ChloroPrep. So I broke it, and I just selected this vein. I'm assessing it, and I took their pulse, just making sure it's all good. So now I'm going to clean it vertically, horizontally, and circularly. And I also want to note that the tourniquet is about 4 inches above the vein. So I'm going to discard that, and I'm going to allow 30 seconds because I want that to completely dry. So now that it's been 30 seconds, and I've already selected the vein, I'm going to apply some pressure right here. I'm going to discard this in my sharp container. I'm going to get the bevel up, and I'm going to go in at about 10 to 30 degrees. So I went in at about 10 to 30 degrees. I'm assessing for blood return, which I have. So I am going to advance another 1/4. And now I'm just going to push without the needle. I'm going to discard. I'm gonna hurry, pop the tourniquet. Apply pressure, and I'm applying this. So now I'm going to apply some temporary tape. And I'm going to assess for blood return. Good, and now I'm going to flush it. So that was good. I'm gonna discard, and now I'm going to apply my Tegaderm. I wanna make sure I don't go above the green part, and I didn't touch underneath my Tegaderm. Mr. Jones, how are you feeling? Good. Okay, so my Tegaderm has been applied, and I do want to note that earlier on this label, I wrote my initials, the time and the date, and the size, the gauge size. So I'm going to put this over here, because I don't want to put it near the insertion side, but it is over here, and it has my initials, the date, time, and the gauge size. So now that has been taken care of, I am going to remove my gloves and clean up my supplies. Also, I was not supposed to remove my gloves yet. I needed to permanently tape this like this. So I removed my temporary tape. We would discard it, we would get a new piece of tape. And you want it to loop like this naturally. And that's how I would have fixed it up. So I was supposed to do that before I removed my gloves. So now I'm going to remove my gloves and clean up my area. So I'm going to discard all of this. So now I'm going to apply hand hygiene, and I do want to document the size of IV that was used, if there was any orders for fluids, how my patient tolerated the procedure, if there was any swelling, bruising, abnormalities, the location, like which arm it's in, and that's all. So now I'm actually going to show you how to discontinue the IV. So I'm going to come over here and I'm going to apply some more clean gloves. I'm also supposed to lower the bed back down and raise the side roll. So I'm gonna come back over here. So now we're gonna raise the bed back up. We're gonna lower the side roll again. We already know that this is my patient, so we are going to discontinue this IV. So the first thing that you wanna do is you want to, so now we're gonna be removing the Tegaderm. You're supposed to go in towards the site. Tegaderm ready. I'm trying to easily remove it. So I'm actually right before I get my Tegaderm off, I'm gonna reach over here. I'm gonna get my 2x4. So I got my 2x4 right here ready. So I got my Tegaderm removed. I'm gonna apply my 2x4 right here. Discard the Tegaderm. So I'm going to get my permanent tape up. Sorry, Mr. Jones, piece of tape hard to get up. document. So I did just get that piece of tape up, and now I'm going to remove slowly, keeping parallel, and I'm looking at the catheter for intactness. I'm just starting in my sharps container, and I'm applying pressure. It actually depends on the amount of time of pressure you apply, like if your patient is on anticoagulants or anything like that. So now I'm going to tape the gauze down. So now on the document, if there was any bruising, redness, swelling, when I removed, I did want to note that how the catheter was intact, and that's all. Thank you.